Welcome to our documentary exploring healthcare in Kitere near Rongo University. Access to healthcare, which is a vital part of community development, impacting education, productivity, and quality of life. As today we speak with a healthcare professional and a local resident to understand the role of healthcare in improving public health. I'm here with Dr. Mito Gordon, a health professional at Kitere Hospital. Dr. Mito Gordon is going to take his time and let us know the state of health care in Rongo Kitere community. He's also going to tell us the challenges that is facing the community and the hospital as general.
Yes.
What is the role of healthcare? One is to create awareness, disseminate, right?
Yes.
Second is to treat.
Okay.
Third is to act as a link between who and why.
Okay.
For example, when there's any pandemic like there was a corona, they can act as a link between the hospital and the community, right?
Yes.
Because this healthcare does not necessarily mean doctors or clinicians. Healthcare is broad. We have CHPs, we even have CABs, the advisory boards, you have the YPPs. They are all termed as healthcare, right?
Yes.
Yes. So you start by the least person in the card, the CHP. What is the role of a CHP? Is to create awareness. What is another role? Is to act between the link of the hospital and the community. It's like ile malaria or something, eh?
Yes.
Before yule mtu afike kwa hosi asaenda akapima, is it really malaria? Asapewa AR. Huh?
Yes.
Yeah. So ndio maana nilikwambia, even if you don't get an expert,
yes,
you can still go, provided you just get almost two people from various, you get a CHP, you can even get a PHO, the public health officer. But what is now the role of the PHO? Wakitembea hata kwa kijiji, they have to ensure that there is what is called free defecation. It is defecation or something like that. People are having latrines to do what? To prevent communicable diseases, like in terms of
yes,
mambo kama malaria. So what is their role when they are doing that? What are they preventing? What are they doing?
Okay.
So you see, these research topics, you don't need to get that expert you are talking about. It's you, hadi upate surgeon, hadi upate what. Niko tu hapa vile unaenda tunasonga hivi ndio viko.
Sasa okay.
Ukifika OC, sasa anafanya nini? Wanapima, they do lab,
yes,
then they treat. At that time, what are they doing?
So they are improving healthcare. Okay, sir, and I had some few questions that I could request that you try to, so that your answer I can get some information on them.
Okay.
Okay. One question is, what are the most common health issues facing the community members here in Kitere around?
The most common health issues, one, when we talk of youth, now we have what is called the triple threats. When we talk of the triple threats, we have the teenage pregnancies, one. We have the new HIV infections, two. We have the sexual gender-based violence, three. Now, ukimusha handle youth, sindio?
Yes.
Then, now, environment as a whole. Mambos, do we have open defecation? Watu kojoa kila mahali, wanaenda choo kila mahali, ama in terms of cholera, in terms of typhoid, do we have latrine? If there are no latrine, that is something you can just walk around. Vitu kama takataka wanaweka aje?
Okay.
do we have any pipe, be it a factory or even some homes, taking it to the river? Huh? Those home, domestic something, right?
Yes. Okay.
Yeah. Now you go to the old age diseases, the lifestyle diseases. Huh?
Yes.
You know the lifestyle diseases? Huh? Are they there? Huh? Are they there? Now.
Yes.
Talking about hypertension, what? Huh?
Okay.
Yeah.
So
if you categorize them, you'll get the answer. You start with youth. Youth to take the triple threat. Huh?
Yes.
Ukienda kwa old age diseases, huh?
Yes.
Utapata kuna mwenye hawezi akakula sijui nyama. Huh? Unaona?
Yes.
How do we call those diseases? And you'll get 2 or 3. Sai pia kuna what is called mental health issues. We have bipolar issues, depression, and the rest. So you can defend your answer because of high economic status. We have some people dying as a result of taking their lives, suicidal deaths, resulting from mental health. What is causing this mental health? High economic what?
Status.
High living standard. As a result of
depression.
Lack of employment.
Okay.
So in giving recommendation, what should you do? You tell the government that as much as there are no formal employment, they should ensure that they train people, capacity build them, and even help them into their various groups.
Yes.
Help them get access or get financial linkages.
Yes.
Such that they can start their entrepreneurship. Talking on entrepreneurship, you can even take, for example, liquids of making. Liquids of making need around 600 for the ingredients. Hello?
Yes, sir. I'm listening.
So you say if the government can link, for example, we have the hospitals around.
Yes.
Assume the government is linking Group A, who is making this liquid soap, to an hospital and saying this Group A will be providing liquid soap for the next 1 month, and they will be paid because there's that amount. Same to various schools, same to various TVETs and the rest. So they come in and train people. Having trained people, they link them to markets.
Okay, sir.
Still, you can also refer to Article 55 of the Kenya 2010 Constitution. Hapo sub-article D. Do you read the Constitution? Hapo utaona government has to provide jobs for youth. Unaona?
Yes.
Ukienda Article 55 hapo sub-article A, unaona youth has a right to get training and to get education. Meaning, as a youth, you have to go through education. Even if the formal education is hard for you, you have to be trained. The purpose of you getting training is that you get access to what?
To employment.
You are mad on a daily basis, so that you be self-reliant. Sawa.
Yes, sir. Okay. Another question was, what can be done to improve healthcare access and outcomes in Kitere?
What can be done? One, healthcare access. One.
Yes.
Are you aware that you have youth-friendly services across? So, ensure that the youth-friendly services are fully equipped. And when I'm talking of fully equipped, you start by infrastructure, you start by staff, and again the commodities. The commodities, I mean the drugs and the rest. Sawa.
Yes, sir.
Other service provisions like OPD, CCC, and CH should also have the same.
Yes.
Another thing, and the hospitals should also have the toll-free number. Like, for example, somebody is in Secretary in South Kamagabo. Somebody is at Kamgiwadu. Huh?
Yes.
Then there is a case, for example, there is a case of cholera in Chamgiwadi. It should take the shortest time possible for the clinician to know. How will that be done? Because sometimes I don't have credit. If you have a toll-free number, meaning it is a number that you can dial without having a credit.
A credit.
A credit. You get me right?
Yes, sir.
So the community will be now accessing, and isikwe kama ile office, you know, most of the office numbers are not received.
Yes.
Na hiyo toll free number ikuwe na mtu mwenye ana receive at any time, ikuwe 24 hours operational.
Okay, sir.
Another thing, frequent dissemination to the community members.
Yes.
Frequent dissemination. It can be in terms of hygiene, like wash programs, right?
Yes.
Yeah, this time if you come with wash programs, next time you are coming with the HIV. For example, when talk coming of HIV, you have so many things to talk about HIV. Also, nowadays people are aware of what of the prevention mechanism. We have the PET here, we have the PET here. What of the access? What do people know? How can I get self-test kit training? Am I in a position of accessing it? Access first. Then, how in terms of skill? How skilled am I so that if I get it, I can test myself?
Yes.
And follow up. For example, you come to me nikakupatia self-test kit, ukaenda ukajipima.
Yes.
Ukatest positive. Who will know that you test? Because if you test positive, you have to redo it again.
Yes.
Do we have a follow-up? We have the filters. Ukianza from vaccination to HIV to TB. Who is doing all those things? So if you have a mechanism of how this thing can be helped, by the end of the day, the service provision, the healthcare as a whole will be done.
Okay.
Next question.
Okay, the next question is, could you tell us about the state of healthcare access in Kitere? Are the doctors or hospitals, the nurses, are they enough for this Kitere community?
Anywhere you will go, you won't get enough. Anywhere you go, you won't get anything enough. You hata uende Nairobi, hata uende there.
Yes.
So the answer you have now.
Okay. Okay, thanks, sir.
Also try to employ those people who are specialized on one thing. Okay. Like for example, naona mtu ako kwa OC, this is the person who can test you know PD, pia anaweza fanya family planning, pia anaweza fanya for optician. By the end of the day, tutakuwa na errors. But if you get somebody specifically anafanya family planning for you, specifically anafanya testing, specifically anafanya surgery. When you specialize on that, you are an expert on that on that meaning. Then on your recommendations, also tell them that youth-friendly services are not ending by having just a youth as a nurse.
Okay.
You need even youth-friendly environment. You get me right?
Yes, sir.
Talking on youth-friendly environment, ukifika hosi, ukifika youth-friendly, inafaa itofautiane na vile umefika kwa ward. You get me right? Ukifika hapa, even those people wearing the nurses things should not be there. We all need to get youth. If it is a daktari, away youth thing, away jeans, away t-shirts. You get me right?
Yes, sir.
Ukiwa na samu ziki, a youth can get there, anasema anataka kuplay Prince Inda. Na anacheza hiyo Prince Inda yake, akitaka kuchukua condom achukue condom na ato.
Okay.
Sasa ukiingia kwa youth friendly, lazima utibiwe ati unataka nini. So that people just know youth friendly is a place for youth, you can just go. Si lazima utibiwe. By the end of the day, people will lose that stigma of going to the hospital. Because as it is, ukienda youth friendly, unaenda kuchukua family plan.
A village woman by the name Elizabeth Ouma says that there is poor services and doctors act like ignorance in the hospital. Due to lack of enough medicines, they are now sent to private hospitals for medication.
Elizabeth Ouma, mimi ni mkaaji wa hapa Rongo Kitere.
Umewahi kuwa mgonjwa mkachukua mtoto huko hospitali?
Yeah, nimewahi kuwa mgonjwa nikapeleka mtoto wangu huko hospitali. lakini vile niliipata si sawa. Hakuna matibabu, hakuna madawa, na venye wanatreat watu si poa.
Madaktari walikuwa wa kutosha?
Wako tu, lakini ni kama wanafanya tu kazi zao,
Okay.
hawashughuliki.
Ilikuwa saa ngapi hiyo?
Ilikuwa mchana, na hata ukienda usiku hawako.
Hao kabisa.
Mm.
Na ungependa nini kusema kwa serikali?
Mimi kitu naweza sema ni tu serikali watusaidie, juu tukienda hakuna dawa, tunaambiwa tuende tununue dawa kwa private hospitals. Sasa kwa hii area watu wengi wanaenda private, juu ukienda dispensary ya hapa juu hakuna matibabu.
Healthcare is essential to Kitere's development, but there is still work to be done. By investing in local facilities, training healthcare workers, and improving access to medicine, we can ensure a healthier future for everyone in Kitere.